Welcome back inside the Now Morning Show. This morning we are discussing childhood cancer, and we're doing so with Just Kidz Emergency. This morning I want to welcome Dr. Kevon Dindial. He's a Paediatric Haematology Oncologist, and he joins us on set to explore what this means. Good morning to you, Doctor.
Good morning. Thank you for having me.
We're having you back because
Yes.
you are in the capacity this morning specifically talking childhood cancer. You
Yes.
said to explore what that means. And so in simple terms, you are a doctor that specializes in childhood cancer. But that's what
Yes.
all of that means.
Yes, correct.
Isn't that bad? Isn't that bad?
It's just plenty big words.
Now, it also means that it's not necessarily something that we would just rush to the emergency of, well, Just Kidz Emergency specifically for. It may be something that is a little bit more delicate in terms of the progress, even
And
identify.
prolonged, yeah.
Yes.
So let's talk a little bit as to what that might look like. How do we discover cases? What does that discovery or that initial conversation look like?
Yeah. So in general, childhood cancer is considered a rare disease. But in Trinidad, we see it quite often, and we see about 30 new diagnoses per year. The most common types we see is acute lymphoblastic leukemia, and we see about 1 to 2 children per month in Trinidad. Leukemia accounts for about 30% of all childhood cancers. Now, how would a child present? It depends on the type of cancer. So in childhood cancer, it ranges from 3 broad categories: leukemia, lymphoma, a solid tumor, or brain tumor. So depending on what the child may unfortunately have, the child will present according to the symptoms. Most commonly, because leukemia is the most common type of childhood cancer, the most common presentations is because the factory that produces all the cells in the body, the bone marrow, it doesn't function. And because of that, their cells will be low. And based on that will cause the type of symptoms. So most of the times, children, these symptoms will be very acute. So within a 2-week period, child will be very well from before. And then they would have what we call signs of low blood count or anemia. So the mother or parents will find that the child is very tired, lethargic, looks a little pale, coming home from school, and usually they're playful, active, and then they just want to sit and sleep. Platelet counts that are involved in clotting of the blood, it's low, so they may have bleeding. So red spots on the skin, medical term is petechiae, or they can have nosebleeds, gum bleeds when they're brushing their teeth at night. Parents may find that this is a bit strange, and then they may be having persistent fevers. So fevers in children, very common, and most of the time
we call it growing fever.
growing fevers, or usually, or virus.
Right.
But I think what parents need to be mindful about is if fevers are persistent. So high fevers, more than 37.8 degrees under the arm, which is called an auxiliary temperature. All parents should have a thermometer at home and know how to use it. And if it's persisting more than, say, 48 hours, I think sometimes that is a little warning sign to
So we
seek
head to
attention.
Just Kidz.
Head to Just Kidz, yes.
Now, before we go any further, I need to ask, I mean, we fresh out of a pandemic, COVID-19. Has that had any impact on the numbers that we're talking about here in terms of the 30 cases per year?
Yeah, it's a very good question, actually, and it has been proven. Actually, I was away during the pandemic, and I got that experience abroad, but it was similar for what was happening in Trinidad. What we did notice is that because of the COVID-19 restrictions, the ability of families to just actively go to the hospital was less.
Yeah.
For the obvious reasons. Fear of getting COVID, being tested positive for COVID and have to go in isolation. And what happened is that we realized that a lot of patients were coming in more advanced disease because they were at home at a longer time. So I wouldn't say the numbers were more, perhaps the children were coming in more advanced diseases and so on.
So again, as much as this is not an emergency situation, what do we do when we have these sorts of suspicions? We've noticed these signs that you've mentioned to us.
Yeah.
We book appointments immediately.
Yeah.
I mean, you're on call as we speak.
Yes.
How do we treat with it thereafter?
Yeah. So I think the first thing is just for parents to be mindful about warning signs that is not normal for their child. Parents know their children best, and I think everyone should listen to parents. So if they have those simple warning signs, persistent fevers, bleeding, looking pale, lumps and bumps anywhere, the first thing that they should do is obviously seek medical attention. And this is where Just Kidz urgent care comes into play. It's 24/7. And the most important thing is that there is pediatricians there that are actually trained and have years of experience in identifying children with cancer or not. And I think that's important in the field of childhood cancer early detection. And I think when you don't have that expertise, it's very easy to say it's something else. And I think that is what Just Kidz will provide in terms of the expertise care because of the experience of the doctors there.
That was going to give me a follow-up because when we talk about childhood cancer or cancer generally, a lot of research goes into that, much of which we don't have direct access to here. We had a guest on the show recently, Faith, who is an anomaly in the sense of the case that she, or the type of cancer that she has, is incurable, but she was successfully able to be housed at a researching hospital, or hospital that does research, so that she is getting her healthcare for free largely.
Yes.
Will that be something that Just Kidz Emergency will then connect persons to? Because the reality may be that it cannot be treated here largely.
Yes, well, because Just Kidz, in terms of the pediatricians there, are very close related to a national service as well as me. That data is always being collected.
Beautiful.
And we are using that to always enhance our care to cater for our Trinidad population particularly. Yeah.
Beautiful. That's reassuring.
Before we get into the treatment, I want to find out more about the testing. What does that testing process look like after you see the symptoms and you say, all right, let me carry them into Just Kidz Emergency? What does the testing look like for those parents who might be a little bit nervous about that part of it?
Sure. So in general, the testing will be blood tests.
Okay.
So they would have a complete blood count. We would probably check their kidney function, liver function, have some x-rays done or other type of radiological investigations. All of that can be done at Just Kidz. And based on that, they would probably call me and we would have a discussion and know which direction to go.
So nothing too strenuous or
Nothing
demanding
too strenuous,
physically
yeah.
anyways.
Just blood tests, radiological investigations, physical exams, and mostly discussions with the family.
Right. Because thereafter, let's say we have a diagnosis of there being some sort of cancer, the navigation of parents and the support therein. Can we talk a little bit about how that goes?
Yeah, so it is known that the most confusing time of a family and child's journey in childhood cancer is that gray area from when they're jumping from doctor to doctor, blood test to blood test, and they just don't know what's going on.
Right.
And it gets better. It's a bit bittersweet. It gets better by telling them that we know what it is, but it's kind of bittersweet by telling them that unfortunately it's cancer. So if a child is unfortunately diagnosed with cancer, which will happen every year, they would be directed to the Eric Williams Medical Sciences Complex, where there's the only 2 pediatric oncologists in Trinidad, so myself and Dr. Botkin. And then we will have an individualized discussion, disclosure, and treatment plan, in addition to meeting with another NGO called the Just Because Foundation to help the non-medical aspect, to help the parents and family get that psychosocial support as needed.
Yeah, and I imagine that the treatment plan would vary based on the person, or is it the type of cancer?
The type of cancer. So in childhood cancer, as mentioned, it's a broad category.
Yeah.
And every cancer is different in terms of the cause, the presentation, the treatment, and the outcomes as well.
What can be some of the causes that would have a child having a parent with cancer?
So again, it's a very good question, and it's very different than adult cancer. Childhood cancer is a very unique type of disease. And in general, compared to adult cancers, where we know that there's a lot of environmental triggers, that is not the case for childhood cancer. The only one environmental trigger is exposure to radiation. But the majority of cases is no known cause, and mostly it's genetically driven.
Doctor, you have done an exceptional job of reassuring us in the case of the ability of institutions to provide the support and information we need. But I am going a little bit personal here, because there must have been something that struck you to say, I want to tackle this insurmountable tasks. You're telling us about incurable diseases, unknown causes, and you chose to devote your life to that. What inspired that?
Well, multifactorial, but of course, there's a need for it in our country. The numbers of children with cancer in Trinidad is generally high. It's one of the highest in the English-speaking Caribbean, behind Jamaica. And it makes sense because our population is 1.4.
Right.
So there's a need for that. And as contrary to popular belief, majority of childhood cancers are curable. And the reason for that is multifactorial. And the reasons why childhood cancer outcomes in what we call low to middle income countries, in which the Caribbean will fall under, is because of multifactorial, so lack of expertise, lack of resources, late detection. And I think that the most important thing is that when you have an expertise to help navigate all those resources, it helps outcomes of these children. And a lot of our children are cured and they go back to a normal life, and families could have their child back. And, you know, unfortunately with our field, there are some cases that are unfortunately not curable, and we have to navigate that journey with the family. But the expertise is needed, and it's very important to help these children.
Any of these treatment plans involve surgeries and that sort of thing, like to remove the cancer?
Yeah, so it depends on the type. For most part, if you have a solid tumor, so say a bone cancer or a Wilms tumor in your kidney, generally you need what we call multimodal therapy. So you need to get chemotherapy and some sort of what we call local control, and that would be in the form of either surgery or radiation or both. So it all depends on the type, and we have all these treatment options here locally available.
And you mentioned the trauma support, or the psychosocial support. How important is that for people to realize that even if, you know, you start off with it and you might think that you're doing okay, I imagine that it's an ongoing process and you need to...
So, I mean, telling a family and a child that you have cancer is the worst news you can actually give anybody. Yes, it's sad that adults, but telling a child is worse. And the unique thing about childhood cancer is that it doesn't only affect the child, it affects the entire family, including siblings. A lot of people forget the siblings. And that is why NGOs such as the Just Because Foundation, and I will give a big up to Siobhan and Noel, who are the founders of that, is actually part of my service. And once a child is diagnosed, I actually incorporate them in my disclosure.
Right. Support is there.
The support is there. They handle the financial aspect. I mean, when you give a diagnosis, one of the parents are not going to be able to work, so you lost income there. Traveling to the hospital. Siblings have to be taken care of because there's unwanted neglect because they have to take care of the child. And what we have also found is that whenever you give a child a diagnosis of cancer or a chronic disease, we know that there's a high strain between the relationship of parents, and we see a high separation rate, and this also causes abandonment of therapy. So this is where the non-clinical NGOs and psychosocial support kind of help me navigate all of that to ensure that the child just gets the treatment.
Because I imagine it's a very stressful situation to find yourself in, and of course, when you keep that tension pulling, things will burst.
Correct.
And life is still lifing while all of this is happening.
Yes.
So support externally is absolutely necessary.
Yes.
And for that, let me say a heartfelt thank you. I am not immediately directly impacted by a cancer case, but the way that you guys handle things in such a thorough manner, not just in terms of you as the individual, but of course the folks at Just Kidz Emergency Medical, making these services available, connecting us to the right options, and of course providing this sort of information here on the Now Morning Show makes navigating difficult situations like this much, much more easy. Ladies and gentlemen, you of course can check them out on 10 Broome Street in St. Clair, or you can call 612-KIDS for more information. But we know we will talk to Kevon Dindial, Dr. Dindial rather, much more. No, well, no, you're my friend. I mean, you've been on the show more than once.
Twice, right?
Right?
Now we're friends.
We're friends. You can go in the fridge. And you can definitely come back at any time to remind us of how we can make the most of these resources and more to ensure that kids have the best possible life and enjoy just being kids. Yeah? So guys, we have more after these messages. We're talking pro league football, things the kids might like. You want to stick around here on the Now Morning Show.